what you try to do is use the ingredients that you can, especially when it comes to actives, that are created in a way or function in a way that you can get the minimum of the unwanted side effects and maximize the efficacy that you're going for.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I've been doing pretty well. I've been thinking more and more about just like eating clean food and trying to be clean. And what does that mean, especially when it comes up to like clean beauty?
Yeah, I know. Clean beauty, I think, is a concept that is being propagated, and we always try to think about beauty, but maybe this concept is trying to redefine it. Well, why don't the two of us just be quiet instead of trying to redefine this and go to the person who actually came up with the concept? What do you say?
I think this is awesome. First of all, you and I being quiet is probably not possible, but I think we have an expert here, Dr. Lindy Fox, and she's one of the founders for VETTED Dermlab, and she's well known as an expert medical dermatologist, the premier inpatient dermatologist. She's a professor of dermatology and director of the Inpatient Consultation Service at UCSF. And Lindy, welcome to the podcast where we are going to be talking clean beauty with you and what it means.
Thank you. Thanks for having me. It is quite a contrast doing inpatient derm for my entire career and now having this new focus. I'm excited to talk about it with you guys. Thanks for asking me to be here.
I mean, you pretty much nailed it right there, which is now you've been an extraordinary medical dermatologist. You've seen the inpatient, the outpatient. You're definitely in the clinic. What is an inpatient dermatologist doing talking about clean beauty? Not that we're asking you in an accusatory way. We're actually pretty excited that you've joined the conversation. Tell us why.
Thanks for giving me the opportunity to tell my story. It actually begins with a very personal piece, which is essentially that I started to get facial rashes. And I do consider myself, a pretty good dermatologist, but I could not figure out what was going on my skin. And I also wasn't really able to eliminate potential, considerations from what I was thinking was causing the problem. And I asked my colleague, Nina Botto, who's also my business partner, to patch test me. And so she did. And she gave me a whole list of ingredients that I was allergic to, some common, some uncommon, limonene, linalool, MI, MCI, and some others. And so I said to her, well, what can I use? And she said, well, you can use, CeraVe or Vanicream. And for anybody who might be listening who's not a dermatologist, another way to think of that is I could use something from the pharmacy that was more of a medicinal, bland skincare brand. And so that's fine and all, but I said to Nina, well, how come I don't get to use something that feels beautiful or has actives in it that I can trust, but the remainder of the ingredients in there are not things that are going to cause problems on my skin? Where's something that's going to be really clean? And she kind of looked at me and she said, well, it doesn't exist. And it became glaringly obvious at that point that not only was there a massive gap in the market, but there must be thousands of people like me that are looking for something that is trustworthy and truly what a dermatologist would consider clean, and also want to feel like you're part of treating yourself, that you are enjoying the products that you're using, or the whole experience of buying something that's lovely and feeling the beautiful bottle and knowing that you're doing something good for yourself, but also not leading to any issues. And so it became obvious, like I said, that there was a gap in the market, but also that there was expertise that Nina had, specifically Nina and Karina, who was her protege at UCSF, also working in contact dermatitis, to help develop something. And so when we started to think about this concept, the first thing you do is you go and do your market research, right? So you go off and you head to Sephora or Ulta or even the store called Credo, which is basically a clean beauty store, And now that I had had some insight into what is sitting on those product labels that could be problematic ingredients, I started reading them all. And I'd also read, this is new clean beauty. This is new clean beauty. This is new clean beauty. And everybody was calling themselves, providers of clean beauty. Yet all of those ingredient labels had ingredients in it that we as dermatologists know are problematic. So there is really no definition of clean beauty. To some people, clean means no toxicity, according to what EWG or other websites like that claim are toxins that are problematic, which that's a whole nother conversation we can have. Some people consider clean meaning that it's good for the environment. Some people consider clean to mean that it's plant-based. A dermatologist may consider clean to be something that's going to have the least number of ingredients in it that can cause allergic contact dermatitis or irritant dermatitis. And so it seems to me that, and I think it seems to my partners as well, that this is our opportunity to redefine clean. Why aren't dermatologists the ones defining what clean is, to include lack of toxicity based in science, because we understand how to read those papers and interpret them, lack of dermatitis causing agents, so using the NACDG criteria for what are the common sensitizers and eliminating them from our product label, making sure that whatever choices that we make, the ingredients that we use are sustainably sourced, that we package it. We're packaged in glass because that's recyclable, and cardboard, which is recyclable. Making those choices and kind of taking from all of those pieces to create a new definition of what clean beauty is. So as it stands, there's no definition, but what we would like to do is redefine it and have people raise their standards of what they're willing to accept when somebody says a product is quote unquote clean.
That's fantastic, and sounds like you have kind of stumbled on an opportunity and with it came up with your definition. What do you tell people who have this argument is that there is a law in physics of action and reaction, and in order to get some kind of a reaction in the skin, whether it to clean it, to moisturize it, you have to put some ingredients that may put you at risk for irritation. Is there a product that's so perfect that can never cause any irritation?
And Lindy, before you answer that, I just want to make a comment that I really, really appreciate us having this conversation about clean, because I think you've articulated pretty well that clean is kind of just whatever anyone wants to consider clean. So it's like clean is in the eye of the beholder almost. And it means everything and it means nothing. I feel like I'm at a sermon or something.
Right, but it sounded to me like you have fallen on the dermatologist definition of clean, correct?
Well, I do think that dermatologists should be the one defining what's clean, right?
Yeah, I actually agree with that too.
What we've also learned in this process, just to go take a little aside, is that the way most skincare products are made is one of two ways. Either they're white labeled, meaning that a laboratory or a manufacturing laboratory has a list of their moisturizers, their cleansers, their ingredients with their products with actives in them that you can pick from. They're pre-made.
Yeah.
And you just stick your name on them,
Exactly.
and now they're yours. That's called white labeling. And the second option is for us to say, okay, let's say I like product X. I'm going to send you this product. Can you reverse engineer it for me so that it's close enough and feels the same way and maybe smells the same way and blends in the same way, but tweak it just enough so that I don't get in trouble, legally, but I can still slap my name on it and have it basically be the same thing. So that's how a lot of skincare products are created out there.
Absolutely. That's probably the vast majority of the market is designed like that.
Yeah, a lot of people don't realize, this is what happens. Your neighborhood, whatever clinic on the corner of X and Y might have the same product as some other corner. It's just different labels, but it's the same producer. Lindy, you're absolutely correct. And so it's just like the same stuff getting pushed around. So it is interesting that you're taking this approach, because now you can take the bull by the horn, so to speak, to say, hey, let me actually create something that's based on what my knowledge base is rather than what's available.
Right. And so what's a chemist's job? A chemist's job is to know what the active ingredients are that do the job that you're asking them to do, whether it's lighten, brighten, whatever. And then they have to know how that chemical interacts and behaves with other preservatives and surfactants or whatever else you've got going in there. And those all have to behave well together. That's a chemist's expertise. A chemist's expertise is not an ACDG list of the top 70 most common allergens. That's not their job to know. So if you say to a chemist, which is what we did, here are the lists of the things you cannot put in. Now create something that works well, blends in well, has the correct actives in it. And by the way, we want this active and this active, but not that active. And this is why. That's a much harder thing to do. And because that's so difficult, nobody really does it. And so wouldn't it be great if that was the definition of clean, that it was taken to that level, that every ingredient was hand selected or excluded for a particular reason. And then it's the chemist's job to make them behave well together.
Right. And you do bring here a point, and I recently had a chance to sit with a chemist, and I think in our dermatology training, we're probably missing a lot on that. And I would argue that we should have some of these chemists come and give some lectures to our residents, because there's so much knowledge there that is missed. And we are now more and more dermatologists resort to compounding. And so having that good understanding is so important. So thank you for bringing that up. That is a great point.
And 100% we don't learn this. 100%. Most of what I've been able to talk about to you right now, I've learned in the last 2.5 years. And it's not because it's not important. It's just not really where we get a lot
How
of
did you pick it up, Lindy? How did you, and first of all, let me just totally agree with you. This is a point that I think a lot of us have realized in the ingredient space, is that it's not emphasized beyond what's going to cause contact dermatitis. We haven't actually talked about their mechanisms of action, or how things play together, or what could define, quote, clean or not. But where did you turn to, or how did you learn this stuff?
Lots of late nights, lots of learning from Nina and Karina, who are, this is what they spend their time doing. They spend their time in the ingredient weeds, so to speak. Trial and error. There's a lot of stuff that will come back to us and we'll be like, oh, this isn't quite right, or let's tweak this a little bit. And I don't profess to know what a chemist knows, not even close. But I do know what I want the outcome to look like and feel like and perform like. And we trust the chemist to help us get there.
Yeah, absolutely. Raja and I always lament that nutrition is not taught enough in medical school. I think some of this chemistry of blending different ingredients into something that is palatable to the skin and still effective is almost a lost art. I have a feeling that maybe I'm romanticizing here, but I always thought of dermatologists in generations ago that they kind of played with the creams and try to figure out what's the best concoction for their patient was. Maybe I'm dreaming, but I definitely think that I would have loved to see more creams in my residency program, in the resident room, kind of creams thrown around, people trying this combination and that combination and really trying to push the envelope on ingredient science, if you will. Albeit, as you said, we are not the chemists, but it's almost like you're not the dermatopathologist, but you have a dermatopathologist and you know what they know and how they can help you. By the same token, in a way, a good chemist and a good compounding pharmacy as the immediate practical extension of that could be very helpful. So now, Lindy, I want to, before we move forward, I do want to push you a little bit and see if you can answer this, because there is a sense of a nature of action and reaction, right? You are trying to achieve some sort of a change in the skin. And so selecting those ingredients, one would argue that if you're trying to do anything in the skin, there's virtually no ingredient that is fully 100% safe. Is that a true statement, or have you found a way out of this, so to speak? It's almost like some patients say, oh, I don't want to take this medication. And I'm like, I understand, but you have a sickness and we try to help you. So yeah, there's a risk of a side effect, but you have to take the medication. By the same token, are there certain ingredients that are completely bulletproof?
That's a great question. I think that what you try to do is use the ingredients that you can, especially when it comes to actives, that are created in a way or function in a way that you can get the minimum of the unwanted side effects and maximize the efficacy that you're going for. So let's take the retinoid that we use, which is hydroxypinoculone retinoate. It's not a true retinoid in the old school retinoid sense, but it is able to bind directly to the retinoic acid receptor. So it's able to be effective yet it doesn't create the same kind of irritation as other retinoids do or tretinoin does. And so it is better tolerated. Does that mean every single person with ultimately the most sensitive skin can tolerate a retinoid? There are just going to be some people who can't. But I don't think you have to have irritation to have efficacy of an ingredient. I don't use irritation as my marker for efficacy in this ingredient space when we're talking about actives trying to sort of improve photoaging and improve some cosmesis. I think that with the vitamin C's, we've been very careful to use lipophilic vitamin C so that they get absorbed better into the skin. And we package our ingredients that are actives in opaque glass with pumps instead of droppers. So that decreases the amount of time that those products are exposed to oxygen, because once they get oxidized, they become less efficacious. So there are things that you can do to maximize the efficacy. But the action and reaction concept is interesting. I don't know that you need one to get the other necessarily, at least in this space.
Well, actually, I also wanted to say this is an excellent point. And I think the reason you're asking, Hadar, is a lot of people feel like, do you guys remember those Selsun Blue commercials where people were like, "Oh, it's tingling, so it must be doing
Oh
something."
yeah, you're right.
And it's just like we get, and it turned out it was probably menthol. And then, it's like we think like, "Oh, my skin was irritating and peeling off. I'm becoming young again." And it's like, well, you don't have to do it that way. It's like rewiring the way we look at how skincare reacts to us.
Absolutely. Now, I will say that when I use pure tretinoin and my skin peels off, because it does, because I'm super sensitive to it, I do feel like that's great. I'm like, oh, I want to remove that layer. That's what I'm going for. I'm exfoliating. Wonderful. But I'm also breaking down my barrier, and I end up with a lot of irritation, and then I end up basically a rash on my face, even though I got efficacy out of it. So the end result of that is that I just don't use tretinoin very often. And so I'm getting no real retinoid effect at all now, because it's just too irritating for me. So it's better for me to use something that's milder, that may be less super powered, but I can get it on every day, than for me to try something every week or 2 weeks only to abandon it because it's too irritating or the side effect profile is too intense for me.
Yeah, absolutely. And you're probably not the exception. Your situation that you're describing with retinoids and maybe with other ingredients is probably more common than we think. And so patients kind of give up altogether. And with some milder and more focused ingredient science, you can actually overcome this. And speaking of the patients and what they feel, I wanted to ask you about dermatologists and how can we make dermatologists really understand better what the patient's needs are so those can be included when we design their skincare?
I love this question so much. I'm a paleo dermatologist, right? I've been doing this for a while now, that I think I fit into that category, like it or not. And we were not trained in any cosmetics or any, we were trained in sort of cosmetic procedures, but we weren't trained in any cosmeceuticals, and it was sort of poo-pooed, and that's fine. I am also a pure medical dermatologist, and I love what I do. But this is something patients want you to be able to answer. This is something that they are coming to you to ask. And if we as dermatologists don't have the answers, they're going to find the answers from somebody else, whether it's an influencer on YouTube, or it's an esthetician, or it's a non-dermatologist working in the dermatology space because they wanted to start doing cosmetics. Whatever that is, in order for you to be able to give patients what they want, you have to understand what it is that they come to you asking for. And so at the end of almost every visit, patients say things to me like, okay, so what should I really use on my skin? Like, what would a dermatologist really just tell you needed?
So true.
Right? It's like every day. That was the other piece of this. It wasn't just going to be clean, but it was going to be, we're going to give you the actives that we think as dermatologists you actually need. And we're going to steer clear of hype and gimmicks and things that, people are finding trendy. We're going to base our decisions on science. And I think we should own that. And I think we should be proud of it and be aggressive about it, because that is what patients want. So the reason I brought up the paleoderm piece is because I do think that the younger generations of recent graduates of dermatologists understand this very well. And they are willing to go there with their patients. They're willing to educate themselves on active ingredients and why to use them and when to use them. And so I think they have a better connection with this ask that our patients come in with. And it's up to the rest of us to learn it.
Well, I wanted to ask, another hat that you're wearing as the board of directors for the American Academy of Dermatology. So first of all, thank you for your service and representing us. But maybe the Academy should come up with some educational content on that. Do we have any resources for young dermatologists or paleo dermatologists trying to re-educate themselves? Is the Academy, is that on the menu for that?
Well, it's interesting because I also do sit on the education committee. I'm the non-voting board representative on the education committee that does come up with curricular development. And that group is having a retreat to recreate, but to sort of have a deep dive into what the current curricula are that are offered and what should be changed and addressed. So ask me again in in about 6 months, and I'll probably have a much better answer for you after that retreat.
I think maybe an important question. Now, you referred to Paleolithic dermatologists. Does that mean that the new ones are Neolithic? And Hadar, does that make us Mesolithic, my friend? Or are we Paleo?
Probably somewhere in between there. Yeah, I think we're sandwiched somewhere in between there.
You're perfect. It's the perfect time in your career.
Oh my gosh, I love that. And that's also the perfect answer to always give, isn't it? Well, Lindy, if you had a ideal scenario, how would you change skincare and how would you change the education around skincare that's being portrayed in the media right now?
Yeah, that's a great question. I think I love famous people just as much as the next person, but I don't think that just because you're famous, you're necessarily an expert in delivering skincare, right? So, and I do think that there are a lot of dermatologists in social media trying to get good messages out there. And I really appreciate that because they're using the current most popular mode of information delivery to give out reliable information. And the media likes things that are catchy, a little bit controversial, a little bit scary, new, hot, trendy. But some of the stuff we're talking about isn't really new to use a retinoid. Vitamin C's have been around for decades now, and there's a reasonable amount of data out there to suggest that they are good. When I was training, my training was that vitamin C doesn't actually do what it's supposed to do in the skin because it can't get there, and I think we know that that's not true anymore. So it's trying to, and this is very hard, it's a very big hill to climb, but it's trying to have consumers understand what they should be asking for and expecting. So consumers understand that organic doesn't necessarily mean good unless organic is really done in a particular way, right? So there are labels for that. There are criteria organizations have to meet before their food is considered organic, etc. I think it's going to have to come from demand from people. So we start with education to have people understand what's real, what's not. And then the consumer has to demand it because the media only does what the consumer demands. And podcasts like this get the word out. Having people buy into the concept of using real data and science to guide the way we choose to do things in this world, whether it's the skincare company or anything else, are going to be really important for people to understand that they should be demanding as the foundation for why they're sold something.
Well, Lindy, just to wrap this up, since we talked about being a paleo dermatologist, but you seem to have reinvented yourself while keeping the original Lindy Fox going. So I want to ask you any tips for our graduating dermatologists on how to manage themselves with industry or going into industry in the skincare space or elsewhere. Tips from your point of view after going through this process.
Yeah. Well, first thing I want to say is that just what you do when you get out of residency doesn't necessarily define you. Your career, it will take lots of different turns, and be open to things that come your way. That has been something that's been really valuable in my career. You don't always know where things are going to go, but if you trust the process and you work hard, you'll often be surprised in great ways. I think the important piece is to own your knowledge and own your space. You know more about the skin than anybody else does, and you are entitled to be respected for that and to demand that you are listened to for your knowledge and what you've worked really, really hard to get through your residency training and beyond.
Well, Dr. Fox, I cannot thank you enough for taking the time and for your expertise and for everything you do with the American Academy, being a professor, helping really to really save patients' lives on the inpatient unit, and then going out there and trying to redefine what clean beauty is. Really a Renaissance woman. Thank you for your time, for your expertise, and I'm looking forward to seeing you again on this program.
Thank you. Thank you so much for having me. Thanks for those really kind words. You made my day.
Guess what, Hadar?
What?
Tickets are selling fast for the 6th Annual Integrative Dermatology Symposium.
Wow, that's amazing. You know, each year this event gets better and better.
Yes, it does. And as a special gift to our podcast listeners, we're offering 15% off registration using the code PODCAST15.
Wow, that's a great deal. And prices won't be going any lower this year, so best to get on it now.
So true. And if you haven't joined us in person yet, this is the year to come have fun at the Grand Casino Resort in Reno, Nevada.
Yep, you'll get to connect with practitioners, engage with exciting research and content, and learn what the integrative movement is all about. Now, all this while nestled between the Sierra Nevada mountain range and downtown Reno.
All that nestling sounds skin-tastic. I know we're all about having fun at the symposium, but this year is over the top. Now look, I'm not much of a golfer, but they have over 40 courses along with rock climbing, equestrian trails, boat tours to Tahoe, pools, arcades. You get the picture, so much more.
Yes, it's definitely a family-friendly getaway. And while they are at the movies, we'll be feasting on, well, no pun intended, but nutrition.
My appetite is whetted. This year's theme has been long awaited. Nourish the gut, nourish the skin as we delve into nutrition.
We can't wait to see you this October 27th through the 29th in person or virtually.